Hello everyone, my name is Dr. Shehzad Saeedullah and I am a head and neck and anterior skull based surgeon. Welcome to my YouTube channel where we take complex ideas and break them down into simplified forms for all the doctors to understand. So if that is of interest to you, please hit the like and subscribe button and hit the bell icon so that you get all the notifications from the page. So without further delay, let's get into today's video. Today we are going to be doing the examination of a neck lump, and if at the end of examination it turns out to be a parotid lump or a thyroid lump, then we will be adding just a few extra steps. So again, let us begin. As I have said in my previous videos, in order to begin any examination, first you need to do 5 things: introduction, consent, exposure, position and light source. So let us begin. अस्सलाम वालेकुम जी, मेरा नाम डॉक्टर शहजाद है। मैं ENT का माहिर डॉक्टर हूँ और आज मैं आपके गले का मायना करूँगा। दौरान मायना आपको किसी किस्म की तकलीफ हो तो आपने मुझे बताना है। आपकी इजाज़त है? So this is introduction and consent. Now coming to the exposure. Ideally, both of your shoulder tips should be visible. Position of the patient, you can either be on the right side or on the left side. Since the lump is on the right side, so I'll be sitting at the right side of the patient. I should be 1 arm length away and I should be at the patient's eye level. And then most important of all, I need a light source. So I need to put it on, I need to focus it on the lump. Examination of a neck lump begins with the assessment of voice and also assessing the breathing. You don't need to check it separately. Since you are taking consent, you already assess the voice. And if the patient is having breathing difficulty, you will be able to hear it without even asking the patient. So this patient is not having any neck lump, but for the sake of explanation, let's consider this as a neck lump. So in order to examine the neck lump, first we begin with the inspection. So on inspection, first we are going to tell the site of it. So this neck lump is located at level 3 of neck. It is laterally bounded by the sternemastoid. Medially there is larynx. It is approximately 2 finger breadths up from the clavicle. So first is the site. Then you will look for the mobility of the neck lump. So you will ask the patient to swallow. आप जरा थूक निकलें. And you will see whether the neck lump is moving with swallowing. Ideally, you should be giving a sip of water for the patient to sip on when he is swallowing. The next thing, if you are suspecting that this is a thyroglossal cyst, you need to ask the patient to protrude out the tongue and see whether it is moving with protrusion of tongue. अब ज़रा मुंह खोलें, मुंह आपने खुला रखना है। अभी ज़ुबान आप बाहर निकालें, ज़ुबान अंदर करें, ज़ुबान बाहर, ज़ुबान अंदर. So if you are suspecting that this is a thyroglossal cyst, you need to see the mobility of it with the tongue protrusion. You don't need to do this step if you are sure that this is not a thyroglossal duct cyst. So after checking for the site and the mobility, now we are going to look for the size of it. So for the size, you need a measuring tape. You will measure it in 2 dimensions. So one is in the horizontal dimension and the other is in vertical dimension. So this lump is approximately 2 into 4 centimeter in dimension. If you are having multiple neck lumps, then you need to measure the largest 2. So after measuring the size, you will comment on the shape of it. So this lump is looking roughly oval in shape, and then you will comment on the surface, whether the surface is regular or irregular. So the surface appears very regular. So in inspection, we noted the hoarseness of voice, we noted whether there is any breathing difficulty, we checked the site of it, the size, the shape and the surface, and we also assess the mobility. Now we will proceed on to the palpation. So in palpation, first we need to see the nature of it, whether this is solid or cystic. We need to palpate for tenderness. While palpating for tenderness, you need to look at the facial expressions of the patient, whether the patient is grimacing, and you also need to ask the patient whether he is having any pain. आपको गले में कहीं दर्द महसूस हो तो आपने मुझे बताना है, ठीक है? So the way that you check for tenderness is gently palpating it and looking at the facial expressions. Then you proceed on to check for the temperature. So you check the temperature with the back end of your 2 fingers. So gently check for temperature and you compare it to the surrounding skin. After palpating for the nature, the tenderness and temperature, now you need to see whether the lump is mobile and whether it is adherent to the overlying skin. So how do you do that? You need to hold the lump and you need to move. You need to be able to move it. If it is moving, it means that it is freely mobile. The next thing that you need to do is pinch the skin, whether the skin can be retracted on top of the lump. At the same time, you also can check for the laryngeal crepitus. You will stabilize the head, hold the larynx, and see whether you are able to elicit the laryngeal crepitus. The laryngeal crepitus in this patient is positive, which means that the larynx is not involved by the growth that is there. Now we need to check whether the lump is mobile with swallowing or not. So in order to do that, you will hold the lump and ask the patient to swallow. आप जरा थूक निकलें, and you will see whether the lump is moving with swallowing. After checking for the mobility of the neck lump, now we need to assess whether there are any more swellings which may be present in the neck. So for that, we need to assess the neck while we are still sitting. So we will start palpating level 1A, level 1B, level 2, level 3, level 4, level 5, and finally level 6 to see whether there are any more swellings which may be present in neck. So on palpation, the things that we have checked are nature, number, tenderness, temperature, fixation to the overlying skin and underlying structures, crepitus, and mobility when you give the patient a sip of water to swallow or when he swallows on its own. Now the next step that we need to do is transillumination in order to see whether the swelling is cystic or solid. So for that, you need an X-ray which has been rolled. You place the X-ray directly on the lump. Then you will take a torch, and the torch should be tangential to the X-ray. And then you will have a peek through the X-ray. If you are able to see your light coming through this, then it means that the lump is probably cystic. The next step in examination is indirect laryngoscopy. So for that, we will take an indirect laryngoscopy mirror. We are going to heat it on the mirror surface. Ideally, you should be using a lighter. So gently heat it, then gently clean it out. We will first check it on your hand whether it's not too warm, and then you need to place it on the patient's hand. देखें ये गर्म नहीं है, ठीक है? Then we will take a gauze piece. पैर इस तरह बंद करें, मुंह खोलें आप. You ask the patient to stick the tongue out. जुबान बाहर निकालें. Gently hold the tongue with your gauze. Lift the lip up and gently introduce it inside in order to have a look at the vocal cords. आ की आवाज करें, आ, तेज आ करें, आ. That's how we are going to be doing the indirect laryngoscopy. After the indirect laryngoscopy, now we need to assess the neck lymph nodes that may be involved along with the neck lump. So for that, you stand behind the patient. You start palpating level 1A, level 1B, level 2, 3, 4, level 5, and level 6. You can also do it with one hand, level 1A, level 1B, 2, 3, 4, 5, and 6. Again on this side, 1A, 1B, 2, 3, 4, level 5, and level 6. Also ask the patient to lift the shoulders up. आप जरा दोनों कंधे ऊपर करें इस तरह. Now we are looking for accessory nerve. This concludes our examination of a neck lump. If at the end of this examination you feel like this lump is a thyroid or a parotid, then you need to add more steps. So let's take the first scenario. Let's say at the end of this examination, you come to the conclusion that this is a thyroid. So the steps that you will be adding are percussion, auscultation, and systemic examination. So let us begin with percussion. So the way that we are going to do percussion is we are going to place one finger on the suprasternal notch, and then with this finger we are going to strike. And we are going to listen to the percussion notes. If the percussion notes are high, this probably indicates that the thyroid is not retrosternal. If the percussion notes are low or dull, this probably means retrosternal extension. Another way of finding whether the thyroid is going retrosternally is palpating the lower end of trachea. So you ask the patient to swallow after thukne, and then you are looking for the lower edge of trachea. If you can palpate it, this means that the swelling is not retrosternal. Another test that you can do in order to look for retrosternal extension is called the permittance test. You have to first explain the test to the patient. जी आपने ये दोनों हाथ ऊपर उठाने हैं इस तरह और आपने 30 सेकंड से लेकर 1 मिनट तक इस तरह पकड़े रखना है. Okay. And at the same time we are looking at the neck veins. If the neck veins are getting incourse, it means that there is probably obstruction at the thoracic inlet, which is because the thyroid is going retrosternally. So if upon doing permittance you see the neck veins getting incourse, this means that the thyroid is probably going down the thoracic inlet. आप दोनों हाथ नीचे रखने. After percussion, the next step that we are going to do is auscultation in order to look for thyroid bruise. So for that, we take a stethoscope. We put the diaphragm directly on the neck lump, and we are going to listen to any bruise that we may be able to hear. A thyroid bruise indicates that the swelling is probably hypervascular, and it indicates a very vascular thyroid. Now coming towards the systemic examination of the thyroid, we are first going to assess the hands. So the things that we are going to assess the hands for are, number 1, we are going to look at the palmar erythema. If there is any exaggerated redness that we can see, we are going to look at the palmar sweating by gently rubbing our thumbs across and see whether there is any increased sweating. We are going to look at the wasting of thenar or hypothenar muscles, if there is any wasting. Then we flip over the hands, we look at signs of anemia that might be there. Then we are going to look for tremors. The way that we are going to do that is ask the patient to hold the outstretched hands and place a piece of paper on top of it. This is in order to see whether the patient may be having any fine tremors because of thyroid disease. After the tremors, after assessing for fine tremors, now we are going to look for the pulse of the patient. And we need to time the pulse. We need to take it for at least 30 seconds. So we are going to see whether the patient is tachycardic or bradycardic. After checking the pulse, now we are going to check the reflexes of the patient. The reflexes that you can check are the bicep reflex. So for that, we slightly flex the head, we place the thumb on the bicep tendon, we take a tendon hammer, and then we are gently going to strike our thumb with a tendon hammer. And we are going to look at the fasciculations. If this test is used to see whether the reflexes are exaggerated or they are suppressed, which may happen in cases of hyper or hypothyroidism. After checking the bicep reflex, now we are going to check the patient's blood pressure. So we are going to take a BP curve and gently wrap it around the patient's forearm. Both of your 2 fingers should be able to go in smoothly. We are going to place the gauge, take the step, and check the blood pressure. After checking the blood pressure of the patient, now we are going to shift our focus towards the examination of the eyes. Now, in order to assess the orbits of the patient, first we need to ask them to take off the glasses. So the first thing that we are going to look for is exophthalmos to see whether the globes are protruding. So we have to check it from the sides, from the left side, and from the right side. Another way of checking it is by standing behind the patient. We will be doing it at the end of the orbital examination. After checking for exophthalmos, the next thing that we are going to look for is lid retraction. Lid retraction happens in cases of exophthalmos where you can see the white above the cornea. So if there is lid retraction, it means that there is probably exophthalmos because of which the orbits are bulging out. The next step that we need to do is to look for lid lag. Lid lag also happens in cases of exophthalmos, in that you will give the patient a fixating point. And you bring it down. So if the patient has lid lag, the orbits are going to come down, but the lids are not going to follow. Again, as I said, this happens in cases of exophthalmos. Now we are going to look for ophthalmoplegia to see whether there is any restriction in the movement of the extraocular muscles. So again, we will stabilize the head, You will give them fixation point. मेरी सुनी के नाखून को देखें, and then you start forming an H. Go up, you go down, then you come to the left side, go up and go down. As I said, now we are going to check for exothermos by standing behind the patient. So we stand up, we gently tilt the head back, and we see whether the orbits are protruding out. Since you are standing behind the patient, this is the point where you are also going to auscultate the chest in cases of thyroid. So you take the step, and with the diaphragm you are going to auscultate. Let me सांस अंदर लें, let me सांस अंदर लें, सांस अंदर लें, let me सांस, and then from the front, let me सांस अंदर लें, सांस अंदर लें. At this point in time, you are also going to auscultate for the apex beat. सांस रोकें आप. You are also going to auscultate the heart. After the orbital examination and auscultating the chest and the heart, now we are going to look at the feet of the patient. So you ask them to gently lift the clothes up. ये आप जरा अपने पैर expose करने, दोनों ऐसा, हाँ जी दोनों करने. Now we are going to look for the tritibial myxedema. So what we are going to do is press it and see whether there is any pitting that is taking place. The other reflexes that you can check in the feet are the knee jerk and the ankle reflex. But since we have already checked for the bicep reflex, we don't need to do it in this patient. But if you want to, you can always check them. The next thing that you need to be doing is checking for proximal myopathy or muscle weakness. So you give the patient the command कि आप दोनों हाथ इस तरह करें और अपनी चेयर से ज़रा आप ऊपर उठें. So if the patient has proximal myopathy, he will not be able to do this maneuver. बहुत शुक्रिया, आप बैठ जाएं. This concludes our examination of thyroid. If you are suspecting that the neck lump is thyroid, you need to add these steps. Now let us take the second scenario. If at the end of examination of a lump you feel that it's parotid, then you also need to assess the facial nerve. So for that you need to give the patient certain commands. जी आप इस तरह करें, अपनी आंखें जोर से बंद करें, मुझे दांत दिखाएं आप, मुंह में हवा भरें, इस तरह और इस तरह करें. So facial nerve examination is very important in cases of parotid. Also, if you are suspecting that it is a parotid lump, you also need to do otoscopy, and you will need to have a look inside the ears to see what is happening in the external canal. So to summarize the examination of a neck lump, you start by assessing the voice. You also assess the breathing of the patient. If you are suspecting that it is a thyroglossal duct cyst, you will ask them to protrude out the tongue. Then on inspection, you are going to look for the side, the size, the shape, the surface, and the mobility along with when the patient is swallowing. Then on palpation, you need to look for the nature, number, tenderness, temperature, fixation to overlying skin, and the underlying structures. And the last step is transillumination. After the examination of the neck lump is complete, you will go and do an indirect laryngoscopy and also assess the neck lymph nodes. If at the end of this examination you feel like this lump is a thyroid, then you are going to add percussion, auscultation, and systemic examination. If at the end of examination of a neck lump you feel that it is a parotid, then you will add examination of the facial nerve and also otoscopy to have a look inside the external auditory canal. This concludes our examination of a neck lump, thyroid, and parotid. In the end, you will thank your patient. जी आपका माइनर कंप्लीट हो गया है, आपका बहुत शुक्रिया. आप क्लासेस दोबारा करेंगे. बहुत मेहरबानी. Thank you. Thank you everyone for watching. If there are any more complex topics that you would want us to cover, please let us know in the comment section. Thank you so much.